My name is Leslie Hamilton. I am a professor in the Department of Clinical Pharmacy and Translational Science in our College of Pharmacy on our Knoxville campus. Today we'll be talking about active learning and giving feedback in the clinical setting. Something that I've learned since my time as a faculty member and preceptor is how important immediate feedback is and how much it helps students and learners to really be effective in an interprofessional setting. So, I work in an intensive care unit, and it's always very intimidating for new learners starting out. There are medical students, nursing students, nurses, and physicians around, and they've often never made those sorts of recommendations in front of a large group of people. They may have interacted with them as students, but not when they have the floor and are making a recommendation. Something that I've really worked on with students is before we go to rounds, having them sit with me, go over the recommendations, and really work on being concise, being confident, and really thinking through what their recommendations may be. So when we get to a larger clinical setting, that it is easier for them because they've practiced what they want to say, and I've given them feedback about how to improve whatever recommendation that they're making. Another strategy I try to use in terms of building confidence after that immediate feedback is the types of recommendations they may be giving. So I will try to start students out with easier recommendations at the beginning. So, for example, someone may have a home medication. Let's say it's for asthma, and the medical team is usually very happy and very willing to start that medication back because that's not something that we want to necessarily stop when they're in the hospital. So, the students can practice that recommendation with me, and they're going to most likely be successful when making that recommendation to the medical team. However, there are more difficult recommendations that students will have to make, which may require some more practice. There's definitely been students I've worked with before. I can remember one in particular who was so nervous to make recommendations on rounds, she didn't think that she would be able to do it throughout the month. So we really worked on her confidence, having her practice all of her recommendations with me and taking that time so she would be confident in making recommendations. It was amazing to see her grow from when she first started making more simple recommendations, being very nervous about them, to be able to independently make recommendations by the end of the rotation month. An example of a more difficult recommendation that maybe requires some more clinical knowledge, some more knowledge of the literature, and a little bit of persuasion as well in working with the medical team is when someone has pneumonia in the ICU setting, which is fairly common to happen. We have a certain type of nasal swab that is available. If that nasal swab is negative, it's very likely that they don't have a particular type of bacteria that's growing in their lungs, and so that we can stop one of their antibiotics. So it's a win-win for the patient. They're not as exposed to this antibiotic for a period of time. The student is successful in making a recommendation, and also the medical team is being stewards of not exposing patients to as many antibiotics. So seeing that student starting with the most simple recommendation, being nervous about that, and really building their confidence because we've practiced with their recommendations with immediate feedback, they are able to move to more difficult recommendations and successfully recommend for a certain antibiotic to be stopped in a patient. And seeing how proud they are of themselves and what a difference they're able to make in that patient's care because they've been able to practice. I've been able to give them feedback in terms of the wording or in terms of the content of what their recommendation is. So that is something that I have noticed is very helpful. Really work with your learners in a clinical setting, whether it's in the clinic, whether it's in the ICU, to really practice their recommendations, and you as the faculty or preceptor to give them feedback to strengthen those recommendations, make them more successful, make them more confident in their recommendations so they are more successful on the medical teams that they work on. Something that I have learned in my time as a faculty member and preceptor is how important immediate feedback is in the clinical setting. It really helps build students' confidence, helps them be more concise, and also successful when making their recommendations. Thanks for listening today.